Throughout the semester, we've had moments when we talked about pulmonary hypertension. You might have heard it in pharmacology as we were going over like blood pressure medicine, vasodilators. But the actual disease wasn't really discussed. You might have just heard the word hypertension and didn't think much more of it, which is what we did at first. And since November is Pulmonary Hypertension Awareness Month, I felt obligated to share some information with y'all that you can put in your back pocket and take with you throughout your career. Pulmonary hypertension is defined by our Lippincott resource as a condition involving increased pressure in the pulmonary artery that may progress and result in right ventricle failure. Now, as a basic person with no with no medical experience at all, I have no idea what I just read to y'all. But after rigorous testing and lengthy periods of time spent journaling and trying to convince their healthcare provider that there's an issue, a person finally gets their diagnosis of pulmonary hypertension, but they often don't realize the magnitude of the disease. They hear hypertension just as we did and think about lowering their blood pressure. It sounds easy. The typical blood pressure medication costs between $0 and $50 a month. That's affordable for most of us. It's pretty easy to handle that. And they go to the pharmacy and they find out that their prescription is a specialty medication and that it must be dispensed at a specialty pharmacy. And then they find out the price of that specialty medication. This is only the beginning of the problem. They take this information thinking that they should just be starting their medication and lowering their blood pressure. And they get home and they take to Google searches to learn the devastation that pulmonary hypertension is a rare disease that causes congestive heart failure leading to death. Often this information spirals out of control as the patient seeks the information, all the information that they can, which leads to further fear, anxiety, and more exhaustion. So I said all the above from personal experience. When my mom was diagnosed with pulmonary arterial hypertension, she had been bedridden for 2 years. She was dying in front of us. There was nothing any of us could do to help. We didn't know what was wrong, and when we found out about the disease, we didn't know enough about it. But the real problem is that her medical professionals, her healthcare providers, also didn't know about the disease. It was still a pretty new disease as far as getting a diagnosis. And a person typically didn't get that diagnosis until they met the coroner's table. We were blessed and lucky when Mom got her diagnosis, but then we were faced with the problem that there were so few treatments available. And the disease is still considered to be rare, as only 15 out of 1 million people have it. However, my mom has it. My dad's mom had it. His baby sister also had it. And there's no relation. Mom is still fighting and spreading awareness daily. As you can see, she's got the whole get up down to her toes, head to toe, zebra. So my Aunt Patty, she was 31 when she passed away. She never did get the diagnosis while she was still alive. So Nana got the diagnosis and she made it probably 2 or 3 more years after.
Yeah, it was, she made it a little bit longer. The doctor gave her Coumadin for, as a blood thinner, and that was the treatment that he gave her. And I said, Mom, that's not a treatment for, you know more than the pulmonologist. I'm afraid I do this time. And we got her to a specialist and she finally got on Traclear. And she lived a couple more years.
So when Mom got her diagnosis, she should have gotten a brief explanation of how the heart and circulatory system works in simple terms. It would have brought more relief to her as a patient if her healthcare team understood a little bit more about what she was going through. Now, to help you guys understand just a little bit, look in your goodie bag and find your straw. You're going to open your straw and put it in your mouth. Now, I'm setting a timer for 1 minute. That's 60 seconds, y'all. I'm starting it now. Pinch your nose and breathe through that straw only. Okay. So, I'm gonna let y'all breathe. No cheating. As you're breathing through the straw, you may start feeling a little bit heavy as you struggle to get air through the straw. You may become slightly dizzy. As you continue, you feel yourself getting a little fatigued. You feel those muscles in your neck that we talk about kind of constricting, getting tight, a little neck tension. We're at 20 seconds. We got 17 seconds left. So we set goals for 5,000, 10,000, 20,000 steps a day. My mom struggles to get 500 steps. So as you feel how you are right now, you're actually noticing a lack of oxygen through your system. Y'all can stop that now. This is how she feels 24/7, 365 days a year. Can y'all imagine going upstairs
No.
with only that much oxygen coming through your system? So there's two types of pulmonary arterial hypertension. The first one is idiopathic, which is also known as primary pulmonary hypertension. And the cause isn't completely known or understood. She was born this way. The second one is secondary pulmonary hypertension, which is secondary to another disease or disease process. Now, for me, in this pop-up presentation, I would love for y'all to take away that secondary pulmonary hypertension may come along with another diagnosis that your patient has. They might have sickle cell anemia. A lot of people who have sickle cell anemia also have pulmonary hypertension. People with AIDS, HIV, they might have that. Let's see, we got COPD, we've got emphysema. There's several different causes to that. Methamphetamine use, even Ritalin. So, some of the symptoms of pulmonary hypertension are dyspnea on exertion, which we've all seen that on our care plans, shortness of breath, wheezing, syncope or near syncope, which I found out is fainting, fatigue, right upper quadrant pain when they're breathing, chest pain, edema, and there's several other symptoms that I would like to challenge you to look up in your Lippincott advisor. So pulmonary hypertension is caused by the narrowing of the arteries and capillaries that move the blood from the heart to the lungs. The heart doesn't stop beating, so the blood gets backed up and pressure builds in that pulmonary artery, which is why they call it pulmonary arterial hypertension. While this is happening, the blood with the oxygen is not being distributed through the body. This is a very simple summarization. I recall one of my mom's big complaints when she was bedridden was that her feet hurt her all the time. She had the feeling of pins and needles, because she wasn't getting oxygen to her feet. And so as the pressure increases in this area, you get inflammation, which also leads to edema, which we all know builds up fluid. This is how we arrive to congestive heart failure. So ultimately, though we say it may lead to that, that's where you're headed when you get that pulmonary hypertension diagnosis. So we've got some diagnostic testing, which includes laboratory and imaging, as well as diagnostic procedures such as arterial blood gas analysis that can show hypoxemia. We've got anti-nuclear antibody tests, which shows inflammation in the blood. People who have like lupus will have that inflammation in their blood. That may be an indication to look at other symptoms for pulmonary hypertension. If they're short of breath, that's definitely something to look for. Then you've got chest x-rays, which can reveal enlargement of the central pulmonary arteries. Lung perfusion and ventilation scanning can show a ventilation perfusion mismatch. You've got pulmonary angiography, which may reveal filling defects in the pulmonary vasculature, as well as right ventricle enlargement and overload is shown through echo Doppler studies. The gold standard for diagnostic pulmonary hypertension is going to be your right heart cath. You've heard, a lot of people get the heart catheterization so they can go in and put stents in the heart. My dad has several stents in his heart, which they did with a left heart cath. This affects the right side of your heart. It's your pulmonary side of your heart. So they go in and check out that pressure that's in your heart and pulmonary artery. Then you've also got the pulmonary function test and 6-minute walk test that they do to monitor how well the medications are working and the progression of the disease. Exercise testing helps with the type of pulmonary hypertension. They want to figure out like the severity of it. What stage is it in? You've got class 1, which includes patients who don't experience any symptoms with ordinary physical activity. So they may just be tired after going up the steps. We're all kind of tired. You can see how this can be missed on a diagnostic interview. You've got class 2, which refers to patients who have symptoms while performing regular activities and they experience a slight limitation of activity. You've got class 3, which includes patients who experience symptoms with less than normal activity and marked limitation of activity. So when you have a patient who says that taking a shower just takes everything out of them and it takes them 2 hours to kind of recoup after that shower, they're usually in that class 3. But then you've got class 4, and this is the last class. This is where my mom was when she finally got her diagnosis. It includes people that suffer symptoms with any activity or even at rest. It doesn't matter. She just couldn't get out of bed. So that particular bit of information did not come from our Lippincott. It actually came from Pulmonary Hypertension News.com functional classification. There's a whole thing. I can share that with y'all if you need it. Risk factors and special considerations include, as we mentioned, the edema, the fluid building up. Your patient may be on diuretics. So we need to check for potassium levels, make sure that they've got enough or not too much. And then we've got the patient who has a yearly or bi-yearly 6-minute walk test and the pulmonary function test to monitor for progression, which we talked about already. Risk factors, you've got more women than men are affected with pulmonary hypertension. Children are also affected. You've got family history, pulmonary emboli, living or climbing in high altitudes, use of cocaine and amphetamines, sickle cell anemia, Now recall, y'all, anemia blocks oxygen from binding to the red blood cells due to a lack of iron. And then we mentioned sleep apnea weeks ago when we were on the sleep study area. So with all the information I shared, I barely scratched the surface. There is no cure to this disease except for a double lung transplant and sometimes a heart transplant as well. It is important for me to stress the need for proper patient education because when you're sharing this information with your patient, you can almost guarantee they're not going to understand it, and they may also need time to discuss what you're saying or to digest it. So be patient with them, be prepared to answer questions and provide resources to help them be more compliant with their medications. They need to know who provides the medication. They need to know, we need to know if they can afford their medication. If they can't afford it, we need to figure out a way they can because they're not going to make it without this medication. Now, I would like to finish this leading into her. We listen to a patient's heart sounds. We want to hear the gallop sounds. We think of a horse. That's what we want to hear. That's normal sounds, right? So, the pH, it sounds like a horse. We can't detect it by listening or taking the normal blood pressure. So, y'all, I'm going to let my mom take over now.
Ms. Taylor, thank you very much for allowing us to do this. I'm so pleased to see the interest in pulmonary hypertension. It's kind of hard to not notice me. I give out these cards that I gave to you. When people look at me funny, that gives me the opening to reach my pocket, give them a card, tell them to read it when they get a chance. And that gives them a little information about pulmonary hypertension on one side, and then why I have the zebra analogy on the other side. Now the zebra analogy, we use that as a mascot of sorts because when doctors are in medical school, they're taught, can I pull that down some? Okay. They're taught that when you hear hoof beats, think horses, not zebras. Through this example, instructors encourage their medical students to think first of the more common and therefore more likely diagnosis when they present with the symptoms of shortness of breath, chest heaviness or pain, fatigue, swollen ankles, dizziness, bluish tint to the skin and nails. And we use periwinkle because that's the color that our nail beds and our lips turn when we're not getting sufficient oxygen. I don't wear periwinkle on all my nails every day of the year, but I do have my zebra and my periwinkle nail every day of the year. My story, Brandy, kind of told you a little bit. We had done weddings since 1988, loved doing the weddings. Last thing I remember is April of 2000, I got a bride down the aisle, and I told Chuck that I needed to go lay down in the back of the car for a little bit. And he said, "Are you okay?" And I said, I'll be fine. Well, that was in April of 2000. I don't remember anything until December of 2002. Because when your brain is not getting sufficient oxygen, you don't remember things, you can't comprehend things. When I was diagnosed, finally, Chuck took me to 14 different doctors. Finally, number 14 had just gotten out of UT, and he thought that maybe if we went to a new doctor, a newly graduated doctor, possibly they had learned about pH when they were in medical school. He said, "Let's do an echocardiogram. Nobody has bronchitis this long." He did an echocardiogram, and by the grace of God, the technician noticed the elevated pulmonary artery pressure that was significantly elevated. Normal is like 7 to 12, and mine was 78. They had said, when my doctor called, he said, "Barbara, you have pulmonary hypertension." And I said, "Great, give me a pill, and we'll take it from there." He said, "No, it's a little more complicated than that. You need to come in the office and we'll sit down and talk about it." And of course, I immediately got on Google, and that's the worst thing in the world I could have done, because it was, oh my gosh, I've got 2 weeks to live. Because I had already been bedridden for almost 2 years, and usually 2.4 years is it if you're not on any kind of treatment. The doctor also told us that if we wanted me to be at Brandy's wedding, she needed to move it up, because there was a good possibility I wasn't going to be there. But one thing that I want you future nurses to remember is that when you have a patient who has been diagnosed with something like PH, we don't know, first of all, about PH. We don't know what our options are. The doctor says you need oxygen. Oxygen company comes out, drops a concentrator, a big tank on wheels that you're supposed to pull behind you, and these cannulas that are like that big around. Now you're already self-conscious enough by having to wear the oxygen and without your ears sticking out. Of course, with masks now our ears stick out. But there's different size cannulas that are available. Patients need to know that there are options with cannulas, with oxygen tank that I fill at home. This is called a home fill unit. You need to be able to have feelings with your patients, and because this is a rough diagnosis to get, especially when you go home and Google. But like I said, I give out the cards every day, hoping that sometimes people say, "Well, my mom is like that. I wonder." And I say, "Ask your doctor about the pulmonary hypertension." One of the fun facts is sildenafil from your pharmacology class. That was they later called it Viagra. It was invented for pulmonary hypertension because it's a vasodilator. When it was in drug trials, this is predominantly a woman's disease. Well, a couple of men in the drug trials had this strange side effect. So Pfizer, kind of got to weighing rare disease or ED. So it was approved, FDA approved for use in pulmonary hypertension about 10 years ago. So one of the main things I want to express is for y'all to do some research on stuff. If you've got a patient just research, not necessarily Google, but do some research. The medications and the treatment costs for this, mine is the cheap one, and it's almost $10,000 a month. There's a young lady in St. Charles, Louisiana, and I don't know why they don't move out of St. Charles, Louisiana. But anyway, hers is $132,000 a month. It has to be mixed every day. She has to wear a pump all the time.
That's a child, by the way.
Yeah.
She's 11.
Yeah. Haley passed away last year. She was 4. She had been on this pump since she was 8 months old, something like that. There's lots of sad stories, but y'all need to have feelings and do some research, on different patients. To let your patient know that there are grants available. Let them know that there's resources. Now, I know you can't do this for every single disease that you learn about. But this one website is called Find Funds, and they have grants and resources for hundreds of different diseases. But just do a little research on stuff. I have been asked several times about what the difference between pH and COPD and asthma are. pH is constriction of the blood vessels. That's why the cylindrical, yeah, there you go.
So y'all can see
Yeah.
on this.
Now, COPD is the treatment, the right medication for your pH, for your patient's pH. But I appreciate y'all listening, but I want to tell you what my goal is, that when a lump is found in a patient's breast, you go to your medical partner and you say, could this be breast cancer? I want you to know enough about pulmonary hypertension that you'll go to your doctor and ask, could this be pH? My message for you and or your patients, that if you or your patient has been diagnosed with asthma, COPD, obesity, sleep apnea, and the treatments are not working, that ain't what you got. More research needs to be done by the doctors and the medical partners. If it's not helping, consider the zebra, pulmonary hypertension. I appreciate y'all. Chuck, do you want to add anything?
Well,
It's rough on the caregivers too, folks.
there's a couple things I could add to that. You know, Brandy had said that there's not a cure for pulmonary arterial hypertension, and there's not. But if it's secondary to something like sleep apnea, and you remove the sleep apnea, that eliminates the pulmonary hypertension. And you wonder how we know all these things. In 2004, we joined the Pulmonary Hypertension Association, and we started a support group for people with pulmonary hypertension in Memphis. And anytime y'all want to come to a meeting, you're welcome. The drug companies come and they bring people from Mayo Clinic and different specialists to come and teach us about these different things. And it's awesome. They buy us dinner, we learn about this, we talk to each other, and I'm going to tell you, Brandy said that there are like 15 out of 1 million. Is that right?
Yes, sir.
Okay, there's about 1 million people in the Shelby County area, the greater metropolitan area. We have 41 people in our support group. We have lost so many members over the years. We know so many people. And what Barbara said about it being tough on the caregivers is an understatement. We know so many people who, when they were diagnosed with pulmonary hypertension, after just a few months, their spouse just packed up and left them. You know, I mean, it's a rough thing. So some of the things that have caused this, people don't know. Y'all remember Fen-Phen?
Mm-hmm.
Fen-Phen was a diet drug that people took. I mean, it was just so popular. Fen-Phen caused pulmonary hypertension in many, many people. There's another thing that it caused too, with the valves in the heart. I can't remember what that was.
Mitral valve prolapse.
Atrial valve prolapse?
Mitral.
Okay. So that caused, we know a few people that have died from pulmonary hypertension as a result of Fen-Phen. I believe one of them was at our support group, yeah. This is something, I took Barbara to 14 doctors because no one knew what to do with it. Now, we have got new people calling us saying, hey, I was diagnosed, and the doctor gave me your name. And we have one lady right now that the doctor said, well, you need to go to a cardiologist. She goes to I'm talking about right now. Within the last 2 weeks, she went to a cardiologist, and the cardiologist said, well, I don't know anything about pulmonary hypertension. You need to go to a pulmonologist. So she went to a pulmonologist. The pulmonologist said, I don't know anything about pulmonary hypertension. So, you know, we have got a few specialists in Memphis, but it's up to the new people coming out of these schools to know about things like this. But a lot more doctors are becoming familiar with it. And, you know, that to me is a big thing. And that's what we try to do, is spread awareness. And when people come to Barbara, and I talk to them too, we tell them about ways that they can get grants for their medicine. We tell them about the different cannulas. We tell them who the specialists are and how we were treated. I had to take Barbara to Vanderbilt in Nashville, Tennessee, to have her right heart cath. So you can do an echocardiogram on someone, but if you don't plug in the mathematical formula, you're not going to notice that pulmonary artery pressure is high. This technician just happened to know how to do that. So, you know, it's a matter of knowledge. Anyway, that's enough said from me.
By the way, I was diagnosed in 2002 and we're fixing to do 2020.
Yeah, so we've passed that 2-year mark.
Yeah.
She was really,
Just got a $10,000 a month pill.
she was really quiet for 2 years, and she got this $10,000 a month pill, and I haven't got her to be quiet since.
Y'all, I know we're just about finished, and I didn't talk about nursing interventions, things that y'all can do when your patient is having these symptoms. You know, we talk about, some of us have talked about incentive spirometry to help with expanding the lungs and getting a full breath in. Just teaching your patient that, teaching them that if sometimes they get, as a result, they get the swelling, they get obesity, they have the fatigue, they need to get a little bit of movement. If they can just set a goal of the 500 steps a day, if they're only able to walk so far, maybe ask them to walk just a little bit further, just a little bit, but don't overexert yourself, you know.
You don't want to faint.
These patients can't push their limitations like a normal person can, so just be like cognitive of that. Do y'all have any questions for them?
No, I can tell you one more thing. We talked about my sister. She passed in 1992. She went to sleep and did not wake back up. We didn't know anything was wrong with her. And when the autopsies and toxicology reports and all came back, the doctor said, there's no reason why this woman should be dead. The only thing we found wrong with her was the narrowing of the pulmonary artery. That's textbook definition for PAH. But they didn't know what to call it in 1992. Mm-hmm. In 1992, one of our guys that joined us, when we first started the support group, there were 4 of us there, you know, and one was a drug rep, and other guy's name was Chuck also. He was on Flowland, which is, you know how people wear a pump for insulin? Flowland had to be done the same way, but it was a lot to take care of that Flowland. And that made him live quite a while, but not everybody could use Flowland. Traclear was the second medication to come out, and she was one of the first people to get Traclear. So anyway, that's how new this is. And it's not rare, in my opinion, at all. I'm sorry, I didn't.
I was going to ask, because y'all mentioned children having it. Is that something in children that they're often born with?
Yeah.
Yes.
It's actually been correlated with SIDS.
Okay.
Yeah. Some of the researchers think that SIDS and pulmonary hypertension is the same thing.
Mm.
Now, that's not been proven, but
They're still working on
They're
it,
still working
but
on it.
it's speculated.
There's a lot of kids at La Bonheur that are on Viagra. And of course, moms get looked at funny when they go into the pharmacist, and the pharmacist says, do you know what this is? Because the medication usually is 20 milligrams per pill 3 times a day. Well, that's a lot. But anyway, I thank you for your attention, and I appreciate y'all's time.
Thank you.